Before I start, I would like to salute all the health workers who are our frontline workers and are doing exceptional and sacrificial work at this time. Tomorrow is the World Health Day, and this day is, will be focused on nurses and midwives. And I would like to take this opportunity to salute all nurses and midwives, all health workers, all doctors, all community health workers, everyone in the health fraternity who at this time is devoting their time to help us fight the COVID-19 pandemic in Namibia. Secondly, to also put everything into context, that as we speak, over 1.2 million people have been tested, positive for the virus all through the world, and we have about 70,000 people who have lost their lives in over 200 countries as we speak. So when you look at that and look at what is happening in Namibia, it helps you to understand how we are doing.
A lot of queries around the 3 that have recovered. Have they recovered from the virus in totality, or did they recover from the symptoms? You did say they are discharged. So one would say they are not symptomatic, and therefore they probably cannot transmit the disease to someone else. So just clarity on that, so the nation is aware of that.
Okay. So before they were discharged, another test was done. So that's why I'm saying they were retested, because that was necessary to make absolute sure that they are totally recovered from that. So at the moment is that they have recovered, they don't have signs and symptoms of COVID-19. So they are being seen as fully recovered cases.
So far as the response is concerned, there are various areas we need to pay attention to. And we have been advising that we need to protect ourselves. If I protect myself and you protect yourself, the whole nation will be protected. And we need to protect our families, so that I don't go out and bring the virus home to infect my family. We need to protect the most vulnerable people in the population or society. And here we are talking, everyone is vulnerable, but we have a particular group that are most vulnerable, and they need special protection. And these are people over 60 years old and people with underlying health condition. And the most important one, we need to protect the health worker. Protect the health worker, because as I said, they are the frontline workers. They are those who are protecting us. So when the head of state says that we should stay at home, we should stay at home so that the health worker will stay at work for us. We should stay at home so that when they come home, they would meet us alive. And we need to make sure that whatever it takes to protect the health worker, in terms of making sure that the health worker has all what it takes to work, to feel confident and comfortable, to give us that care when we need help is there. Then we need to make sure that we can isolate those who are showing signs and symptoms and test them. And when they are positive, we treat them. And then we trace everybody that they have been in contact with. Now, this is what we are advocating. And you can see that here in Namibia, the whole government has taken this up. Of course, under the leadership of the Ministry of Health. But look at us here, with the two ministries ably represented and the media. So it's the whole government approach as well as the whole society approach. This is a battle that can only be won if we pull in the same direction. Now, having said that, I just want to say a bit about the last question you asked, Honorable Deputy Minister. How do we know that the 3 people who we say have recovered are indeed recovered? So to be able to do that, we do 2 tests to check. After we see that they don't have any signs and symptoms, 2 tests to check that they are negative over a period of between 24 and 48 hours, to assure us that when they get back into the community, they do not have the virus to infect others. And this is very important, to give people in the community that these people are safe to come back to us. Because they've been in isolation, we have tested them at least 2 occasions to know that they are virus-free. So apart from not having any signs and symptoms, they don't have the virus. And I think it's important to assure everyone that this is what they can safely be integrated into their society and their families.
Thank you very much, Doctor.
Say, in other words, if you could draw a map of all the patients, are they all connected or are some not connected? And I think that's important for us to know, because that will give us an understanding if we are getting cases that are from other sources than the first that we discovered. I hope my question is clear.
I think it's clear. Thank you very much.
The Honorable Deputy Minister has said, at the moment what we have is that we don't have any community transmission at the moment, because most of the cases, almost all the cases that we have either come from outside or they're in contact with someone who has come from outside. Yeah. So at the moment we don't have community transmission, and this is really very important, because when you reach that level of community transmission, then things begin to get out of hand.
But how is the contact tracing going in determining those, either those that got the virus from someone who was outside, or they themselves got it from outside and brought it into the country? Now, the people they were in contact with, how is the contact tracing coming along to determine whether or not there has been this community transmission or not?
Okay, thank you so much, Honorable Deputy Minister, for that question. So at the moment we have a team of our surveillance officers. So what they do is they get a list of possible contacts with someone who is confirmed, and then they try to track and trace these contacts. So once the contacts are traced, then there is what we call isolation or quarantine. So those contacts are told to quarantine themselves, because at that moment they all don't have to be tested for COVID-19. It's only when they fit the case definition that then the testing is done. Yeah, so once the contacts are identified, then they are self-isolated. They are told to self-isolate, and then monitor the surveillance team continues to monitor the signs and symptoms of those contacts. If they meet the case definition, then that's when they are tested for COVID-19.
All right. Yes.
I think the point that the Honorable Deputy Minister and Dr. Apollo have made, I think these are very important. And that's why I started by saying that the strategy is really, we need to isolate, test, treat, and trace. You know, because most of the cases we have are coming, invariably, all the cases are coming from outside. So these are imported cases. Now, what happens once they get here, it becomes important. Now, if we are not able to trace their contacts, it means that we are losing into the community. So the team is working 24/7 to make sure that every contact has been traced. Because unless you trace a contact, then you have a loose end. You see, once you get all the contacts, the whole idea is containment. And to be able to contain, you need to ring fence the index case and all the other contacts. You quarantine them within the incubation period. So if there are any signs, then you can isolate them as well, test them, you treat them before they move into the community. Because once we get into the community, then we have exponential increases. They are not just 1, 2, 3, it's like a bomb. Wow. Because one person can infect between 400 to about 500 people if you don't do your contact tracing well. So this is a very important point that we should take note of. And that's why, as an individual, you need to make sure that you are protecting yourself. Because imagine I have the virus, and I have 2 people in my home. If I infect them, they also go out. In my office, I'll say about 50. I infect all of them. The 2 infect about 20 each. So already we are talking about 90.
Yeah.
Each of the 90, if even they infect one person, from me alone, within a short time, I've successfully infected over 500.
Yeah. Thank you very much, Doctor, for that. Of course, when the news broke that we got our first 2 cases and so on, there was a rush towards getting supplies, especially gloves and masks. And it seems the message worldwide is that this, first of all, is essential for healthcare workers, for them to be enough in the country to be used by actually the people dealing with those that have tested positive for COVID-19, but also that they seem to be used for certain instances when perhaps you have a greater risk exposure and so on. Just a little bit for the nation to really hear when to utilize the mask, when it's necessary to do so, or when to utilize the gloves and so on, or is it sort of mandatory to really protect oneself?
Thank you. Thank you very much. This is a very important question. And it's come up almost every time. And as I speak, there are discussions and very interesting debate and discussion, not only here, but all over. And the WHO are aware of that. Just on Friday, we had a technical meeting and with experts discussing it. We are looking at all the available evidence, and then we are going to evaluate the use of mask, especially the use of mask for the general population. And once we are able to do that, we will come out with specific recommendations. However, let me take this opportunity to address key issues based on available research, evidence we have to date. is that mask, and we need to pay attention here, mask for the one who is sick, the one who is taking care of the sick, and the one who is not sick. Now, the one who is sick wears the mask to protect others, not themselves, because they're already sick, they already have the virus. So it's to protect others who are not sick. The one who is taking care of the sick wears the mask to protect themselves from the one who is sick. So it becomes a barrier. Now, the one who is not sick, healthy, the evidence is that if the one who is not sick is doing the key drivers of this outbreak, like social and physical distancing, personal hygiene, hand washing, respiratory etiquette, etc., there is no additional protection if the person wears a mask. And this is very important. There's no additional. So once you're doing the right things, there's no additional protection if you wear the mask. Now, the second most important thing is that masks such as the surgical or medical mask and respirators, you may hear something, some people call it N95, FFP2, FFP3, N99. These are really made for the health system to support the health workers and protect them. And therefore, we need to prioritize their use for health workers. As I mentioned, we need, by all means and at all costs, to protect our health workers. Because if we lose them, already we don't have enough. So we cannot afford to lose any. So we need to prioritize their use for them. There are discussions on other homemade and cloth mask that you see on the social media, etc. These are what we are looking into to see how suitable it is for the general population. But as I said, the evidence that we have, once you're doing the right things, do not really have added value. Another important thing to remember is that sometimes when you have the mask on, you tend to have a false sense of security and protection. I have mask on, but bear in mind, the mask is not covering your eyes.
Yes.
If you don't wear the mask well, you are not benefiting from its protection. And so if you have it and you tend to, okay, because I have it, I'm okay, you are deceiving yourself. If you do the right things, social distancing, personal hygiene, hand washing with soap and running water, sanitizer, these are things that have been proven to interrupt the transmission. And that is why we constantly emphasize on that.
All right. Thank you very much, Doctor.
Good afternoon. I'd like to know from you, Namibians I find are very interesting people. We have a way of settling into something very quickly. I think already for me, I can see that we're not quite as aware as we were about when the president announced lockdown a few weeks ago. We've become a bit chilled about it. We see the cars that are driving around Windhoek. Let's not even fool ourselves. There's really not a lockdown really happening in Windhoek. We walked into this venue now and we did not get the opportunity to be sanitized. We just walked in. And this is a room where that should be on a heightened alert. We should be on heightened alert. So I'd like to know from you, Dr. Esther, just from a mental health, psychosocial perspective, what's the message that you would have to Namibians? Because I guess it's when we lower our defenses is exactly when the virus really sneaks in and really, at the end of the day, we sit with huge numbers. So if you could maybe just address that, peak day, what have we done to prepare for that day, and just the message that we have for Namibians at this stage, you know, just to keep their alerts up. And then the health professionals, a third question, sorry.
Please, we're running out of time, so just quickly.
A third question, just about the health professionals. We know that one was positively identified last week, a health professional. I'm not sure if it's a nurse or a doctor, but that was one of the statistics we got last week. And we understand with reason that the health professionals obviously who work with us at the hospitals, they were panic-stricken. How are we helping them from a psychosocial support perspective, specifically to help them to continue to go back? Because we're not even in the peak yet, but they have to continue to go back to treat us. Thank you, Honorable.
Thank you.
To go to the psychosocial support, if I got the question right, to our health professionals. Yes, we are fully aware that we are putting our health professionals at risk because they are the frontline workers, and globally we know that they are at high risk of getting infected with any virus or disease, because when the person presents himself or herself at the health facility, one cannot tell whether that person is infected or not, and that is a situation that they find themselves in. And that is why from the start we have been saying that to deal with this pandemic we need all sectors of our communities, and that is why our health psychologists and social workers have been deployed as well, so that they can also provide, you know, counseling, help people to calm down. So they are working with the health workers, providing the necessary psychosocial support. On the issue of the hand sanitizers and gloves, whether we have enough or not, of course, as a country and all the countries elsewhere, no one was really prepared for this. No one expected that we will have a situation like this one. But we are doing our level best, and that is why we are also encouraging people and retailers and all businesses also to make their own, because people can also make hand sanitizers. It's not necessary that we just have to buy from the shops. So, and people, and I know that many people in their homes, they have their homemade hand sanitizers. The death or burial that are, you know, related to COVID-19, of course, we will deal with that as a state funeral. But of course, from the time that the person passes on, the government will know, we appreciate and we know that we have different cultural and traditions in Namibia that are also dealing differently with the death in the family. So we will appreciate that and we will acknowledge that. So the government will not just go and take the body and bury it, but there will be consultation with family members, because the family members, in the first place, they are devastated, they are grieving their loved one, so they need to be provided with that necessary support. So they will not be ignored at all. There will be consultations to talk to them, to try to find out from them where do they want to bury their loved one, what time, which day, and so on. So it's not only a matter of government taking the body and bury it, but the family, of course, will be consulted. And the reason why any COVID-related death would be a responsibility of the government is because the body would still be infectious. And to prevent that, it's why the government is taking responsibility. And that would not be the first time, because in cases of Ebola, for example, these are also funerals taken care of by the government. The breakout in the informal settlement, are we ready for that as a country? I said that the government, all sectors are trying their level best. And we are monitoring the situation, and we are learning also lessons from other countries. And that is helping us to prepare for ourselves for the worst case scenario. So at this moment, I would say that one would not really wish and hope that we will come there, but should we come there, it's a matter of all sectors pulling their resources and expertise together and deal with the situation. Yeah.
Thank you, Honorable. Dr. Moses, pick day.
Okay. Before I answer, let me just say something small about the informal sector, because it's very important. I think that for the informal settlement, we need to actively engage the community. And as I speak now, I know that part of the response team is doing that. But let me also appeal to the media and others that let's really engage them, not as if we are telling them what to do, because they have their networks, they have their systems, they know what works, they know how they operate. Let us listen to them. Let us find solutions with them. Because if we give them our solutions, it won't work there. So we need to really sit down with them and say, look, what can we do? What are the ideas you can bring forth? We have very able community leaders there, community networks that are working, and we should make use of them rather than we do something and we give to them. We in the past will prepare even leaflets, information, etc., and say, here you are, use this information. They have community slangs, community language, which we don't know. Therefore, let us sit with them, plan with them, implement with them, and evaluate with them. I think that is the only way we can really reach out and then make a difference. Then my question about the peak. The peak, you have to look at two things. We use modeling to predict when you get to where, and secondly, the response. So, for instance, you look at how you are moving, the rate, and you look at where you double. Where is it like we started with 2, and suddenly within a matter of a few days we are at 8. Are we going to remain there? And then you also take into consideration the factor of community transmission, because once you get into community transmission, then you are not ahead of the virus. So the idea is to get ahead of the virus. Once you are ahead of the virus, you can dictate. But if the virus is ahead of you, the virus will tell you what to do. And so all this information are factored into your modeling to see where you are going. So with the peak, you reach the highest, and then you start coming down. Yes.
All right. Just final words.
And as a final message to the community, I want to say that as much as we are in a very critical time now, we should also learn to take these challenges and turn them into opportunities. It's time for us now to start thinking divergently and thinking outside the box. And you see that people are now becoming more creative and innovative. We see the tippy taps that people are creating and so on. So my message to the people out there is that we are all in this. And I am responsible, you are responsible, we are all responsible to take care of ourselves. And when we say stay home, it means stay home. It's not a matter of, for some people who think now, it's holidays, it's time for me to and you still see movements in the streets. And I really want to use this opportunity also to commend the residents of Arandes, because I was listening to the news last night and they were clear that there are no movements in the streets, people are adhering. So then it is our responsibility to make sure, because the virus is of such that you don't know the person that you are visiting, where has that person been, where did it touch, you know. So it's very dangerous. It's the reality that we are finding ourselves in now, and we all have to take responsibility.
Thank you very much, Honorable. Yes, Dr.
Protect yourself. Protect your family. Protect the vulnerable in society. Let us all together protect the health worker. And we do this if we would wash our hands with soap and running water, or use sanitizer. We practice respiratory hygiene. You cough into your elbow. We maintain the social or physical distancing. And we make sure that if we are not well, we don't go to where people are. If you are not well, report to the health facility as soon as possible. This will be my concluding remarks.
Thank you very much, Dr.